Rifaximin is a rifamycin-based non-systemic antibiotic used for the treatment of gastrointestinal bacterial infections, such as traveler's diarrhea and irritable bowel syndrome, and reduction of overt hepatic encephalopathy recurrence in adults. In this video, let's found. What is rifaximin? What is rifaximin used for? Contraindication. What are the side effects of taking rifaximin? How does rifaximin work? How to use rifaximin. What is rifaximin? Rifaximin is a non-absorbable, broad-spectrum antibiotic mainly used to treat traveler's diarrhea. It is based on the rifamycin antibiotics family. What is rifaximin used for? Rifaximin has multiple indications by the FDA for the treatment of patients greater than or equal to 12 years of age with traveler's diarrhea caused by non-invasive strains of Escherichia coli, for the reduction of overt hepatic encephalopathy recurrence in patients greater than or equal to 18 years of age, and in May 2015 it was approved for irritable bowel syndrome with diarrhea, IBSD, treatment in adult men and women. Contraindication. Due to the excellent safety profile of rifaximin, there are very few contraindications. Patients with hypersensitivity to the rifaximin, rifamycins, or excipients should avoid this medication as hypersensitivity reactions like exfoliative dermatitis, angioneurotic edema, and anaphylaxis have been reported. Side effects. The most common side effects include nausea, stomach pain, dizziness, fatigue, headaches, muscle tightening, and joint pain. It may also cause red discoloration of urine. The most serious side effects of rifaximin are Clostridium difficile-associated diarrhea, CDAD, drug-resistant bacterial superinfection, severe allergic reactions including hives, rashes, and itching. Pharmacodynamic. Rifaximin is a structural analog of rifampin and a nonsystemic, gastrointestinal site-specific antibiotic. This non-systemic property of the drug is due to the addition of a pyridoimidazole ring, which renders it non-absorbable. Rifaximin acts by inhibiting bacterial ribonucleic acid, RNA, synthesis and contributes to restore intestinal microflora imbalance. Other studies have also shown rifaximin to be an pregnein X receptor, PXR, activator, as PXR is responsible for inhibiting the pro-inflammatory transcription factor NF-kappa B, and in inflammatory bowel disease, IBD, rifaximin was proven to be effective for the treatment of IBSD. Mechanism of action. Rifaximin acts by inhibiting RNA synthesis in susceptible bacteria by binding to the beta subunit of bacterial deoxyribonucleic acid, DNA, dependent ribonucleic acid, RNA, polymerase enzyme. This binding blocks translocation, which stops transcription. Half-life. Approximately 6 hours. Dose. Traveler's diarrhea. Indicated for traveler's diarrhea caused by non-invasive strains of Escherichia coli, E. coli. 200 mg POQ8HR for 3 days. Hepatic encephalopathy. Maintenance of remission. 550 mg POQ12HR. Irritable bowel syndrome. Indicated for irritable bowel syndrome with diarrhea, IBSD, in adult men and women. 550 mg POQ8HR for 14 days. Recurrence of symptoms can be retreated with a 14-day treatment course, up to 2 times. Available in unit dose package containing 42 tablets, i.e., 2-week supply, for this indication. Safety advice. Rifaximin is pregnancy category C. This is a new agent and little information exists on safety in pregnancy. That's all the information about rifaximin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.